principle is to overcome that barrier of delayed services. So, but yet we're telling people we have to wait for MFNR to provide the services. And that could take how long?
I'll let you answer.
Well, actually, this lady's, I think we need to kind of address this one first, and then we'll address yours. So those are the challenges that we face. And as Don mentions, you know, we are still very underfunded within our schools, within our education system, to provide those services needed by our children. And you know, there's so many children that are still coming, we're still finding, right, that need services that were never addressed before. So those are some of the big challenges that we have to work through to see what kinds of things we can do to support those areas. When you talk about the school-age child, I think that, you know, there's jurisdictions, there's still jurisdictions, even though we say, well, there shouldn't be any jurisdictions between this or that, and we're still finding that. And we need to work at that. We need to work at lifting those boundaries and so we can reach the children. But I think as a community, we need to do that in that grassroots place, and the service providers have to follow what is being set out by the community, by the First Nations community that is wanting the services. And I say that there's still going to be challenges, because the people that come out to your community, say for instance our services, we're limited to the school system. And if the child is not in school and they're school age and they have disabilities, because of those disabilities they can't be in school, those are the challenges we face, and those are the challenges we have to try to work through and work with each other so that child can have that service of being able to go to school. I think that we've been so enclosed in thinking that we don't have money for that educational assistance or educational assistant to work with that child if we bring them to school. Because this is so new, we will look at finding avenues of trying to provide that service. So hopefully next year we can find a way of getting that child to school. But right now there's a lot of challenges that we need to work through and talk about so that that service can be provided for the child. And in regards to the funding, it's always limited, but I'll let Dawn explain a little bit about what the parent, Harriet Pruden, commented about that area. So maybe you can address that area for the dollar piece where that extra funding is not there.
Yeah. So I'll respond to Helen's question.
It wasn't, sorry, I just want to clarify, it wasn't funding, it was service provider.
Wait, this for service. Yeah. Sorry. I think I'll try to respond to both at once. And doing 5 of these in 1 hour points, it's like we could spend all day on this. It's so complex. I'm going to give you all a little history lesson. So when I first started at the Manitoba First Nation Resource Center, I came from the province. Services were all around. I'm a parent of a multiply disabled child. All the services in the world, he's always had them. He's 26 now, doing very well. When I started working in First Nation communities in 1999, we started with a student population of 15,000 students, level 2 and 3 funding for severe or profoundly disabled children. We only had 42 children of 15,000 funded in '92. When the Resource Center started, that evolved. By 2006, we had 1,500, 10% of our students funded at level 2 or 3, either severely or profoundly disabled. The federal government was realizing that those costs in Manitoba were climbing pretty high. So they changed from something called an assessment-based model to an intervention-based model. And this speaks to your question. So every First Nation community fills out, instead of an individual application, so Edith from Ebb and Flow has to fill out a work plan to get her high-cost special education funding. Marlon does, any of the other resource teachers. This is targeted funding by the government. When the Liberal government took, okay, so I'm working with a small community in Manitoba. There was only 20 kids in 2006. Suddenly, they built a new school, they opened a group home. There's now 80 kids in that community. 20 of them are funded are severely or profoundly disabled. I still, up until September, could only get one child funded of those 20 through the INAC education high-cost special ed. So the chief, oh my God, we constantly advocated because they had 20 kids who needed EAs, they needed support. That school, up until this year, had never had a psychologist in it, ever. So, because this was block funded from 2006 until 2000, that funding didn't increase until 2016 when the Liberals came in and doubled this amount. So the intervention, and this is one of the reasons we want to do this workshop, is that Jordan's principal and health workers and CFS need to understand the history of school funding in Manitoba First Nation schools. Because our region was given $25 million up until September of 2016. That doubled with the federal Liberal announcement of increase to high-cost special ed. So suddenly our First Nation schools, every First Nation school had this amount doubled. So Marlon, if he was doing his work plan for 15-16, it was an amount, it doubled. So that community, I know the child you're talking about, their special ed funding doubled. But what has to be taken into consideration is the tuition amount that these communities get to fund their schools. We're working with a two-tiered system now. If you work at Broken Head, you're part of the Manitoba First Nation school system. They receive a specific amount of money, substantially more than a locally controlled school. So that's why there's some of those challenges. So we can say, yeah, this child needs an EA. It should be in the special ed work plan. That school has been underfunded for 20 years in this province. They may not have money for an EA. And there's one of the challenges that we're running into. However, I do know other First Nation schools that are funded higher than any other school across Canada now for special education. Because if you were funded at $1.5 million in 2015, and that increased to $3 million, that community now has $3 million for high-cost special ed. You can do a work plan for $3 million. You can get anything you want with $3 million if we're providing the clinical services. So it's important to understand that. And one of the things we think, here are the eligible categories: student assessment, early intervention, individual small group, and that's where your EAs would fit. And your special or your small group, large group, and your professional development. So what we recommend, and we'll close this, is kind of a three-step process.
I have a question.
Where because there's some kids that have gaps in services, but there are other kids where there's multiple people now involved in their lives. So sometimes we have gaps, and sometimes now we even have duplication of services. So how do we avoid that? So 3 steps, keep it really easy. Identify who's working in all your systems for each community. And I'll get to your question in a second. The second step is develop a birth to death continuum of care. So go school age or preschool, school age, and adult. Many of the parents we talked to yesterday are terrified that their supports, drop off the end of the world when they turn 18 or 21. We need to build that adult system. So think about as a community committee, so Vanessa gets together with Edith and someone from CFS and pull in someone from rehab center, someone from our agency, and develop a continuum of care from birth to death. Think about sensory. What am I talking about when I talk about sensory? What disabilities am I talking about? There's 3 of them. You're all disability experts. Visually impaired, hearing impaired, and scotopic sensitivity or Irlen syndrome. Those are the 3 sensory disabilities that we need to plan for across the lifespan. Physical disabilities, social, emotional, mental health, learning and developmental disabilities. So identify that continuum of care that needs to be in place. And then what I think people should do, correct me if I'm wrong, take your Jordan's Principle work plan and your special ed work plan and take the numbers off, because people get really sensitive, especially with all this jurisdictional stuff. God, Director of Education in Brokenhead does not want to share how much the school's getting with health over here. Take the numbers off, but put those plans together. And how can we align them? Because I think then we can, this isn't just Jordan's Principle. This is a school that, the school has just had an additional $25 million provided to it. So why is there not an EA? We've got to get to the bottom of that. The only way we'll be able to do that is if we put those plans together. Now sometimes it's a new resource teacher coming in the community. They haven't even seen the work plan. That's a barrier. So how do we bring those 2 plans together? And then when we do that, I think we can get to what we were doing when we were working with Edith and Vanessa. Is it okay if I use your names? Because you guys did a really good job.
Do I get Mark?
Doing that. And maybe you can
Do I get Mark?
So
yeah,
you're doing that circle of care in the community, what you're doing there,
yeah,
is what I present in each community, getting all the resources together,
yeah,
pooling them, sitting at the same table,
yeah,
and the education is there, so
yeah,
are the resources.
Yeah.
And they're the ones with the huge questions. And those are the questions that I gave to you, is what you
yeah,
asked me. So I agree with you. We
yeah,
should put those 2 plans together.
yeah,
Because this way Jordan's Principal's team as well as your team are on the same page.
yeah.
Okay, I have this young lady's been like waiting to ask you.
Oh yeah,
I just
sorry.
actually wanted to say that with the child that is not attending school, and with the Jordan's Principal program and all the funding that's out there, that why is there not a child development worker hired to be with that child, to take that child to school, like right now? Like why is there not, there's funding out there, and it's to provide children's needs without delay, so why?
Yeah, I agree with you.
Why is there not something?
And there shouldn't be any of these kids who aren't in school. They should all be in school.
Especially if they're waiting to go to school.
Yeah.
And there's tons of funding to.
Yeah, and it gets
left, but I think that they did do that in the interim for to have a solution to that could.
It's hard. It's hard when you have a very challenging support system that you could never have put in place if you didn't have the dollars to do it, and also a person who's trained. Like, you can hire someone, from wherever, but are they trained? Do they have the knowledge of being a good person for that child to support them in that system? So those are the challenges that we face right now. And that's why I said it's going to take some time to put those kinds of things in place. They're not just going to happen. And yet, when we talk about things that's in black and white, and we need to consider, like what are the needs of that child, and can we facilitate that right now in that system? Do we have the room to do that in that school? Because a lot of times our schools do not have space, even for the children who are already there. So, I'm not trying to put a damper on the ideas, but we also have to consider those. And yes, definitely go forward with those ideas. But again, we have some challenges that we have to look at before those things happen. They just can't happen right away, right?
And I would agree, as Helen said, if we have a circle of care around each individual child, I think we need to go back to the system and do this community-based system circle of care and be clear about that before we get to the individual child, because there's misunderstanding, there's relationships that have to be repaired, there is misunderstanding, and it's all about communication. And you know, I had a frustrating meeting a couple of weeks ago, and I ran into the health director. She said, and I was kind of mad, and she said, you get back there. You go and you work with all those people, you keep talking it through. And it was hard, you know? But the thing is, we ended with, we put, of the overlapping kids, each child's name in the middle, after we did the systems piece, and we came up with a brilliant, I think, a brilliant plan, you guys did, for each one of those kids. And it meant crossing boundaries. I don't know if you want to speak to it, Edith? Or
we just did, we did individual plans. When we put our numbers together, our students together, we ended up with 11A that we both had. So what we did was, I kind of put a template together. It's nicer than yours.
I also teach her at university.
And then I had, like, on one side, and I'm willing to share that if Vanessa's okay with that, without the names, of course. But we had the Jordan's principal on one side, and I'm all for IEPs, of course. And then our school, what services am I going to give? What professional services? What support services? What is she going to give? Yeah. So that I don't have my speech and language therapist assessing the same student that she had already assessed. So now we got these services here, we got these over here, and then we bring it together and we say, okay, this is the care plan. This is what Jordan's principal is going to do. This person is going to bring that student into the school who can't be in our school right now because of behavior, because there's a lot of assessments to be done. But her worker is going to bring that student into our school for about a half hour for the social piece and to go into the classroom. And then we call them all transitions, and we're hoping that everything will be transitioned by June.
Yeah. And what I saw,
this lady had a question, so
okay.
I just wanted to know, like, my education director, I'm from Peguis, I'm the CFS director out of Peguis.
Yeah.
And our education director was pretty upset because your entity received money, and I think communication at this time, because the ground is moving as we're walking.
It is, yeah.
And
it's
I
a good way to put
think
it.
if we recognize that first, it'll kind of decrease the tensions, because we all want the same thing. But communication is key. So if I go onto your website, will I see a Jordan principal portfolio in terms of the funding that you've got and how it's going to impact the community that I work in, and how it reduces or increases, you know, the ability of the school to work in the circle of care? I just want to reiterate, communication is key.
Yeah.
Communication, lack of communication resolves with conflict, right?
Yeah.
So I think, you know, communication on websites is really important, because I can go there and I know who's providing what services and who's responsible for what. And I know when we're looking at the healthcare system on reserve in Peguis, it's really hard to figure out who does what. And there's people that have different jobs. So when we are working with our clients, we don't know who to refer and who has what qualifications to do certain assessments, right? So that's always been a struggle for the last 8 years that I've worked in my community. And it continues to be. So, you know, and we continue to try to work at it together and improve communication. So if I go to your website right now, what will I find? Will I find something?
Nothing.
You know what? That's
What we can.
we do forward the information to the schools, and that's another piece that we talked about is we do send the information to the schools, but a lot of times it's not distributed to any other people, right? And so that's one of the things that we were talking about, is that the information we send from our organization has to spread throughout all of the other pieces within the community, right? So that's a very good suggestion, that we do put the stuff on the website. And we have talked about it. We do send it out, but again, it's only to the schools. And a lot of times it just stays there. It doesn't go out to anywhere else. So thank you for that.
So what we can give you, and we can give it to you electronically, and we've sent it to all the Jordan's principal. Here are all the schools in Manitoba. And it's interesting because Sherry, I'll get the lady's attention from Pegasus. So your director of education actually built part of this. Yeah, she advocated for this. And all of our education directors. So we can look at PEGWIS, and we can give you a list of which special ed specialists with speech language, which OT, which PT is assigned. Now keep in mind we have 2 physiotherapists for 54 communities, for 4 to 21. We put out our referral, we only receive referrals from resource teachers, and we thought that would streamline it. We've just started our service. We have had 3,200 referrals from September until November 15th. 3,200 referrals. So we have 2 physiotherapists. They can only get to so many places. A quarter of the children in northern Manitoba who are Cree have hearing loss sufficient enough to impact education. We just have 1 audiologist.
What was the timeline again? September to what?
September to November 15th. We asked resource teachers for referrals. Now some of those referrals are, there may be a child who needs speech and OT, so it's not 3,200 children, but it's 3,207 referrals. But we haven't, still from some schools, we haven't got their referrals yet. So healthcare plans for a year source, children with lifelong complex medical needs, people with life-threatening allergies, seizure disorders. We had 250 kids referred to us in the first month. We have 1 nurse.
Now, speaking on that 1 nurse,
Yeah.
it's only they have to attend school for us to tap into that resource, right?
Yeah. And that's one of the other issues, is that we're only school-based, and some of the services that we provide, Frontier doesn't. Some of the services that we provide, Rehab Center for Children doesn't. So it's complex.
Somebody had a question or had their hand up back there? Yeah, I think it was that one.
Where can you find that?
I'll make sure this is on our waiting list, but I can email it to you.
I think it wasn't sent out because it identifies for all the communities, and people start to question when you send everybody the same. And we have limited numbers, like what Don is mentioning. We only have 1 nurse, 1 physiotherapist, and 2 physios. And so it becomes a little bit complex when people start looking at the whole thing and saying, well, how come this and how come that? So we're trying to get to the avenue of where the resource teachers know who is coming to their schools. Again, we're just sending the information to the schools, and so it doesn't kind of get out to everybody else.
But your director knows who goes to your school. She knows how much time they go to the school. She knows which of your community members are in our training programs.
But I don't know, as a Child and Family Services Director, what you do. I don't know.
Yeah.
And I should be able to go to your website, and I should be able to know what you do, so I could work with the education director, and we could advocate for children in care. And children in care go to Winnipeg for services. And I never knew, there's a lot of stuff I'm learning, and it's great, but I would like to be able to access information on your website in terms of the funding you received from Gordon's principal and how that impacts.
Well, we weren't even asked to present here. I had to phone and say, why aren't we on the agenda here?
I'm glad you did.
Yeah.
I'm glad you did, because
So we pushed our way into presenting here.
So, anyways, you know what? They keep coming to the door again and saying our time is up.
Before I forget. So the training you talked
about you're opening it to our case managers and their staff, like during the summer months. You talked about it being a struggle where there might not be education, so that would be a solution.
Give me your card. Just make me mad. Good boy, I
program that we did this year, and I'm very open about how much money we get. It cost us $250,000, and we had a waiting list of just. There's how many EAs in Manitoba? There's 800 EAs working in First Nation schools. A lot of them are newly hired. So we for every spot that we had, I think we had like 10 people wanting to go.
Yeah, but we had to limit it to 2 because of the cost.
So if we can get more money for those summer institutes.
No, I just have joint services with rehab centers for children and stay them on because they have all these state providers.
They kind of do and they kind of don't, especially for high cost. Because when you showed you that plan, if I showed you a work plan, you'd see how fast that money would go.
Why not?
Yeah.
Otherwise, one agent will be closed.
PC, oh my god.
Oh no.
Yeah.